Bleeding disorders. So bleeding disorders occurs mainly due to three major defects. First one is blood vessel abnormality, then platelets disorder, and the third is coagulation disorders, right? So first of all, we'll discuss blood vessel abnormalities. It can be either congenital or acquired. In congenital, there comes hereditary, hemorrhagic, telangiectasia or HHT, right? In acquired, there comes vasculitis, scurvy, or vitamin C deficiency, or other disorders causing vascular fragility also, right? Now the second one, platelets disorder. So basically platelets disorders are of two types. One is quantitative and the other is qualitative. So in quantitative disorders, there is an abnormal number of platelets, or we can say thrombocytopenia. It occurs usually due to decreased production, right, or reduced production. It is bone marrow failure or suppression, increased destruction in immune thrombocytopenia, or increased consumption, that is in DIC normally, right? Now qualitative disorder. So in this, platelets count is normal, but platelet function is abnormal, right? Example, Glenn-Mann's thrombocytopenia, right? Bernard-Souliam syndrome, it is inherited, or acquired platelets dysfunction. Example, aspirin, NSAIDs, or uremia, right? Now the third one, coagulation disorder. So these involve abnormality of the clotting factors. It can be inherited or acquired. In inherited, there comes hemophilia A due to factor 8 deficiency, hemophilia B due to factor 9 deficiency, or one Willebrand diseases due to VWF deficiency or dysfunction, right? Now acquired. So it is basically due to liver diseases which reduce clotting factor synthesis, vitamin K deficiency due to decreased factors 2, factor 7, factor 9, or factor 10 also. DIC, which consumption of platelets and clotting factors, right? Anticoagulant therapy, example, warfarin, heparin, right? Now coming towards the clinical differences between platelets disorder and coagulation disorder. So basically, in platelets disorder, there are superficial bleeding, while in coagulation disorder, there is deep bleeding, right? This is the main difference between these two. Now, so far the diagnosis is concerned, we usually do CBC and platelet count, right? Then we can go for PTINR, for APTT, or peripheral blood smear, or platelet function test, or one Willebrand factor testing, right?